Yes, thank you so much. I'm going to mention some names that may not be familiar to you, but everybody in this room will know them. I've talked to the leadership of Baptist Medical Systems, UAMS, and St. Vincent's, the three largest hospitals in the Little Rock area, with clinics all over the state. I've also talked to Conway Regional, White County, Jacksonville, and Saline County Hospital. And they're all telling me the same thing. The smaller hospitals are about a year out from bankruptcy. The losses they take on Medicare, but you'll lose it. Bigger hospitals say they can hang on another 2 or 3 years. And that's the guns you're on. These are people we've known all our lives. They're not some esoteric. They go to church with us. Their kids play ball with us, with our kids. So how do you address that argument? Because they say they bought on. They danced with the devil. They know they did. They admit that. But now they're in a rock and hard place.
Well, first I'll give you the real answer that will be of no use to you as a politician. And then I will give you an answer that might be of use to you. The real answer is this. The best evidence, the best research that's available suggests that America's healthcare sector is incredibly wasteful. In the Medicare program, 1 out of every $3 that Medicare spends does absolutely nothing to make patients healthier or happier. So that's a almost $500 billion program now. We're talking about, pretty soon you're talking about real money. A major driver of healthcare spending is healthcare capacity. There's a law in health economics called Romer's Law. It goes like this: a hospital bed built is a hospital bed filled. So if there are hospital beds, doctors tend to respond to the availability of supply by doing more admissions, doing more stuff while patients are admitted. So that's a major driver of spending, but what the evidence shows is that a lot of those admissions are unnecessary. A lot of the tests that people get in the hospitals are unnecessary, and you're exposing people to a lot of harm in hospitals. Hospital-acquired infections, medication errors, and so forth. In Arkansas, you have 23% more hospital beds per capita than the national average. Wow. So if on average 1 out of every $3 is wasted, in part because of the excess capacity and people just using the resources that are there, the fact that you get 23% more hospital beds suggests maybe you could stand to lose some hospital beds. Because a lot of those hospital beds, I want to be clear, are being used in a way that does not make patients healthier or happier. And seniors and other patients might be better off with fewer hospital admissions. So the answer that you cannot use is maybe Arkansas could stand to lose a few hospital beds. Now, here's another
Conway not gonna like that.
Yeah. So but here's the thing. Another answer you can't use. Medicaid is not a jobs program. It's a healthcare program. If you want to create healthcare jobs, well, then you should ban oximeters, blood pressure machines, those really cool beds that move patients around so they don't get pressure sores, all sorts of other labor-saving medical devices they use in hospitals, because you ban those things, and you're creating jobs for the nurses and the lab techs and the orderlies to do all those things by hand. The only problem is what?
They don't know how to do it.
No. They'll learn. They're smart. They'll learn. The problem is healthcare gets more expensive when you do that. So treating Medicaid like a jobs program makes healthcare more expensive. You don't want to do that. Now, here's an answer that you might be able to use. Yes, you're between a rock and a hard place. You kind of brought this on yourself, but I get where you're coming from. You're facing all these Medicare cuts, the dish cuts. This is not the deal you thought you were getting. Why is it that you think that so you've been disappointed by 2 existing government entitlement programs? Why do you think the solution to your problems is expanding and creating government entitlement programs, creating a new one? What we need to do is we need to reform Medicare and Medicaid, and in that endeavor, I will stand shoulder to shoulder with you as we try to reform those at the federal level. But the solution is not to go spending money that neither the state or the federal government have, because that's going to kill jobs. It's not going to expand. He's looking at me skeptically. I don't know that I gave an answer.
Actually, we are shoulders.
Well, that's the answer that I was looking at as though you were a hospital executive.